Good evening, you're watching NDTV with me, Rishika Barwa. This is the show where we take your questions on the coronavirus. You can call us and we'll have a panel of expert doctors to answer all of those questions. Our number is flashing there on our screen, so do dial us with your questions related to the coronavirus. So what are we focusing on this evening? Well, the government has made it mandatory for the Arogya Setu app to be downloaded by anybody and everybody who's moving about, especially if you're resuming work. If you're traveling out of your house, it is imperative for you to have that app. How does an Arogya Setu app help? What does it mean to have this app? We'll have health experts look at those questions. We've so far had people from the world of technology answer some of those questions, but does it really help? How does this aid doctors if they already have this information about you? Joining us on the broadcast this evening, we have Dr. Balaji Jagmohan. He's a consultant diabetologist from the Apollo Sugar Clinics in Bangalore. He's an active fitness enthusiast. He plays badminton and is also a yoga enthusiast, I'm told. Dr. Rifai Shaukat Ali is joining us as well. He's a senior consultant interventional cardiologist from the Apollo hospitals in Chennai. His patients describe him as a gifted doctor. So thank you so much, doctors, for sparing the time of day and being with us here on the broadcast. Let me begin, Dr. Rifai, if I can, with you and ask you a little bit about the app. So, you know, it's not just India, there's China and Korea, Singapore, the UK is now, in the process. The NHS is going to be launching an app as well. So how does this help doctors? How does this help patient and doctors to have this information readily available if you could see it on somebody's app? Are these really the ways forward as we lift the lockdown?
Absolutely. I think the important question is about the applications, the utilization of the application. So what essentially it means is, particularly in countries, as you mentioned, like particularly South Korea and Taiwan, they also have these apps, which has been uploaded by a million people. What it does is it's actually contact tracing the people. So essentially it will tell you where exactly you are in. Are you in the red zone or yellow zone or green zone, or have you traveled into these zones? So these kind of applications will be given to you as you move around from one place to other. What is your risk of having this contact tracing those patients who had positive testing? So it will help in many ways into identifying people who had tracked through those zones and to identify how to treat this, how to pick up these people, and particularly the contact tracing as well. So importantly, these apps does help a lot, and that's been used in as you mentioned, these two countries. Absolutely been helpful in those countries too.
Right. Dr. Balaji, anything you'd like to add? Digital technology, to essentially be able to map coronavirus cases, to, segregate zones, who's vulnerable, who's not, where should you go, where shouldn't you go. That's one aspect, of the story, which is for the government to be able to track these cases, map the cases, aid in contact tracing. But as a doctor, what's your opinion on a COVID app, perhaps, as a savior in these times?
Yeah, I think definitely what the cardiologist has already mentioned. I think that these apps will be very useful. One is it will give you the location of your patient around you, and also it tells about your health status if you are at the risk of getting a COVID-19 infection. So definitely I think these apps are the future, as we look into it, and probably it will help us in better contact tracing, and probably we can have better prognosis.
Right. And, doctor, have you already, been able to diagnose patients better because of an app like this? Or do you know of doctors who are using the app to be able to better diagnose patients?
So I do know of doctors who are using these apps, but the thing is that it all depends on how many patients are actively using it and how many doctors are also actively using it, because we need to keep the Bluetooth as well as the GPS on to give you the exact location and to know that where the COVID-19 case is. Also, if a patient has come in contact with you, let's say at that point he was asymptomatic, later on it will be useful for tracking and tracing that particular, the entire chain. Even you could be put on quarantine.
All right. So the app generally, doctors believe, is a useful tool even for doctors to be able to monitor, the high risk patients or where patients have been before they can actually prescribe further treatment. Our first caller, Zahid, is calling us from Shillong. Go ahead.
Hi, Rishika. Since I'll just run through one quick question here. Since a lot has already been spoken about, the symptoms of the coronavirus and the way it can be prevented and the precautions that we need to take, I just have a slightly different take on this today, and that is since the onset of this pandemic everywhere across the globe and the country, there are a lot of people who would fall sick and who would actually be going to the hospital otherwise if the situation was something else. So now that they are not being able to visit the hospital, or maybe they are having an apprehension to visit the hospital since they are afraid they might contract this disease, would you say that a lot of people, aside from these death tolls that we have from the coronavirus, could it be that other chronic diseases, could cause people to advance to progressive stages of disease, which could have been cured otherwise?
Okay, so Dr. Rifai, if I can take that question to you, it's not like other diseases have stopped in times of a pandemic, but do you believe that perhaps a lot of other patients with chronic diseases are being neglected because of the coronavirus and the situation in the country at the moment?
I think that's a very pertinent question at this point in time, particularly in your lockdowns and everything. See, what we know from data showing that the first 2 to 3 weeks of the pandemic is a very important time, and we suggest patients not to venture out. So even patients who have heart diseases, have anything unless they have any other symptoms or new onset, we advise them to stay at home and not to visit hospitals. But now things are extending, and now we also come to realize, as the gentleman very clearly mentioned, that patients who have chronic diseases are undergoing some issues. Now it's nearly 2 months down the line. Patients who have heart failure, for example, they're patients who have weak pumping of the heart, they need their adjustments of medications to be done. And patients who have heart problems like other valve problems and blood vessel problems has to go and reach the hospital.
Right.
So this is one of the important aspects we are looking at it now. Particularly, we are having more data coming from Europe. So, for example, there is a data coming from Europe saying that patients, the death rate in this particular time is much more higher than compared to last year. But not all these excess death rates is due to corona. So essentially, there are 30% of these excess death rates are due to other diseases which has not been picked up, or which the patient didn't even venture out to see the doctor. And that's an important aspect we also need to tell the patients now, that if you have a medical problem and if you think that you need an attention, and it's better you go and reach down to the hospital, because now most of these hospitals are having emergency facilities, and we don't want to lose patients sitting at home thinking
absolutely.
about...
And most hospitals also have facilities which are segregated for COVID and non-COVID patients. So if you are somebody who is suffering from a comorbid condition, or you are undergoing treatment for a crucial disease, then please be in touch with your doctors and please avail, hospital services if you should in fact require them. Syed Nasir, our next caller, is dialing in from Delhi. Go ahead.
Good afternoon. And Doctor, good afternoon. My name is Nasir from Delhi. Hello, ma'am.
Please go ahead, ask your question, and we request you to mute your television audio.
My question is, my son is 16-year-old, and is his some thought in, or he take a medicine of telecast.
Okay.
From 2 months, but there is some cough and concussion is also there, and no doctor is ready to take any medicine. What are the step I will going for any hospital or anything?
Dr. Balaji, would you like to answer that?
So I think that it is important, first of all, we need to find out whether it is an upper respiratory tract infection of any other cause, or if that person probably has a COVID-19 infection. So I think this gentleman needs to call the helpline, either the state or the national helpline, and probably they will facilitate a sample collection to rule out the possibility of a COVID. So I think that would be worthwhile, rather than trying to reach out to doctors who any which ways are trying to refuse treatment to his son.
Right. Dr. Rifai, anything you'd like to add?
So the important thing is, I think, depending on which part of the country they live, they have an official helpline number to contact.
Right. The caller is from Delhi, so definitely there is a helpline and all services available.
Absolutely. They can contact the local helpline number, particularly when they have suspicious symptoms like this, that upper respiratory tract infection. It's better you contact the helpline number. They will come and do the test. And nowadays, the things are moving on so forward. I think there are talks about self-quarantining at home. There are a lot of other states that are moving towards that. So I don't think you need to worry too much about COVID-19 as such. The important thing is we are going to live with that. I mean, these are things we are not going to get rid of in the next few months. Essentially, it's going to take a long time for us to completely get rid of it. So we have to start living with that, to live with that, and we should adjust it. I mean, these are important things like hand washing and masks, social distancing. I mean, been told million times. I think people, as long as they stick to these protocols, you can just carry on with your reasonable life. I mean, there's no need to panic and sit at home all the time. I mean, there are recommendations.
All right. So if you do develop symptoms, then you must avail of the facilities. Absolutely. And in a lot of mild cases, there is home recovery, which is an option now. The government has said that if you have space in your homes where you can self-isolate, a room to yourself, then they will allow you to do so, provided your symptoms are mild. GS Chawla, our next caller, dialing in from Ludhiana. Go ahead.
Yes. Rishika, my question is, how safe it is to swim in a swimming pool because number of swimmers throw water from their mouth inside the pool?
Sorry, could you repeat that question? We couldn't hear you correctly.
Yes, my question is, how safe it is to swim in a swimming pool because number of swimmers throw water from their mouth inside the pool?
Right, the question is regarding swimming. Dr. Balaji, you're a fitness enthusiast yourself. What would you like to tell our viewers? Swimming, clearly, is it a good idea in the times to come?
So I think at this point of time, it is better to avoid swimming because let's say that you have an asymptomatic or a symptomatic person as well. Probably he coughs or sneezes and there could be droplets that could be dislodged into the water. So I think it isn't worthwhile at this point of time to consider swimming as an exercise because we are talking about physical spacing, so definitely in swimming there will be hardly any physical spacing. So I think this is something that should be avoided. Of course, this gentleman can take up other exercises. There are several other cardiovascular exercises that could be done.
All right, so several other exercises that you could take up at a point like this. You don't necessarily need to opt for swimming. It could work out to be risky. Dr. Refai, anything that you'd like to add in terms of exercise? You're a cardiologist. I'm sure you have a lot of patients to whom, you prescribe regular exercise. What are you telling them to do?
Yeah, so the important thing is, I think now we are easing the lockdown. I mean, see, essentially what we are looking at is people who are less than 60 years of age and people who are above 60 years of age. Because what we know from the data that if you're above the 60 years of age, don't venture out at all. Try and stay at home, do your own workouts, maybe go upstairs in the terrace, you walk around and do things. But if you're below this age of 60 years, I think it's time you can walk out as long as you just take your mask on and walk around. There's definitely not activities like gym or swimming pool with a lot of kinds.
So no common spaces basically. Any space which is accessible to other people as well is not something that doctors are prescribing, but that doesn't mean you give up your exercise. So do exercise at home. Yes, doctor, you'd like to add something.
Yeah, so other thing I wanted to say is yoga is a very useful exercise. Now you see at this point of time, there are a lot of mental health issues which are on the rise. People have stress, depression, anxiety. So any form of yoga, you do pranayama, you do asanas, you can do dhyana. All this will definitely physically as well as mentally calm you.
All right, that's extremely useful advice. Rafi, our next caller is dialing in from Chennai. Go ahead.
Can I ask a question? Doctor, after lockdown is over, so I had to go to my office. It is nearly 40 kilometers to and fro. If I go by car, they're fully covered with glasses along with the AC. Is it safe to drive car on roads? Is there any chance of getting infection from outside if I drive on car?
All right. Dr. Balaji, would you like to take that on?
Yeah, I think this gentleman, any which ways, has to wear a mask. And it's better if he has a sanitizer with him so that, if there are any surfaces that he's bound to touch, so he can sanitize his hands immediately. But I don't think there is a risk to, travel in a closed car with the AC on. But if you use a mask and you do not interact with anyone on the road, I think that would be safe enough.
All right. Dr. Refai, anything you'd like to add? There have been a lot of questions about the use of air conditioning. Whether it's safe to use air conditioning, whether it could, aid the spread of the infection. What would you like to say, given that we are in the peak of summer?
Yeah, so in terms of as my colleague just rightly mentioned, travel in a car is not a problem at all. But the main thing you need to see is when you open the door, for example, the main problems of this is about contacts. So when you open the door, make sure that you have clean the door handles before you open the door, if you think that somebody has touched it. So if somebody has put a petrol or fuel on your car, so make sure that you just wipe it off. So inside the car as such, you don't have any issues. You can have your air conditioner on because you're the only one who's driving the car. Maybe you may have your family or something. So that's not an issue. The air condition issues comes mostly in places like hospitals, like theaters and malls, where a lot of people comes around. I think that is going to be an issue which we need to look into further in terms of how do you adjust your working environment, particularly in hospitals where we work. We see a lot of patients coming with COVID-19, and how do we do that? I think that's something every hospital is looking into. They have different options to whether to create some negative pressure, and all those things has been going on. And every hospital is tuned to do these things. But in the car, I don't think you need to do anything, adjust anything as such.
All right. Our next caller, Safdar Hussain, is dialing in from Burhanpur in Madhya Pradesh. Safdar ji, क्या है आपका सवाल?
हाँ मैडम, मैं ये पूछना चाहता हूँ कि इजराइल एंड इटली अभी उन्होंने जस्ट रिसेंटली क्लेम किया कि दे डेवलप द वैक्सीन. अब वो उन्होंने वैक्सीन डेवलप कर लिया ये वो कह रहे हैं, लेकिन वो कब तक के मार्केट में आएगा और उसका क्या इफेक्ट होंगे, और ये डॉक्टर से मैं पूछना चाहता हूँ कि क्या वो इफेक्टिव होगा.
All right, Safdar ji, बहुत अच्छा सवाल है आपका. Thank you. But any of the doctors would like to take this on, the vaccine development. Several questions, several studies, several countries in the race to develop a vaccine. Would you like to lend clarity, Dr. Balaji?
Yeah, so जैसे इन्होंने अभी बताया, जो इटली और इजराइल में अभी इन्होंने जो डिस्कवर किया है, सो इजराइल में उन्होंने मोनोक्लोनल एंटीबॉडी करके कुछ ट्राई किया है, और वो लोग क्लेम कर रहे हैं कि वो मोनोक्लोनल एंटीबॉडी देने से कोविड-19 पूरा क्लियर हो जाएगा. बट ये अभी बहुत ही इनिशियल स्टेज है. इसका क्या परिणाम होगा फ्यूचर में वो हमें देखना होगा. और आप जो इटली की बात कर रहे थे, उसमें उन्होंने क्या किया, कुछ प्री क्लिनिकल स्टडीज, मतलब माइस में उन्होंने कुछ एक वैक्सीन दिया है, और उसमें देखा कि एंटीबॉडी का प्रोडक्शन बहुत अच्छा है उन सारे माइस को देने के बाद. बट वो प्री क्लिनिकल है, अभी उसका ह्यूमन ट्रायल्स करके वो मार्केट में आने के लिए बहुत टाइम लग जाएगा, 6-7 महीना लग जाएगा.
All right, very useful information there. So it's there is a lot of research that is in fact taking place on developing a vaccine for COVID-19, but we are still months away, as there are several layers of trials and approval that have to happen for a vaccine to be able to enter the market. We're going to slip into a very short break at this juncture, but both our doctors are going to continue to be live with us on the other side, so keep your questions coming. Welcome back. Dr. Balaji and Dr. Refai continue to be live with us. We left off at the all-important discussion of vaccine. Dr. Refai, we didn't give you a chance. Is there anything you'd like to say?
Absolutely. The important thing about vaccine, as you know, that with any virus, it takes a long time to develop, as Dr. Balaji has clearly mentioned. So when you talk about vaccine, we talk about three phases of clinical trials. The first is the phase 1 and phase 2 and phase 3. The phase 1 is when we look at around the safety of the vaccine. So essentially the first step is to use the vaccine in animal models and then in human models to make sure that they are safe. And then we go for the phase 2 and phase 3, which is the effectiveness of the vaccine to be tested. But even, there are talks going on already about whether we can combine the phase 2 and phase 3 for particularly situations like this. Nevertheless, you have to make sure that you finish your phase 1 and then only you can go to phase 2, phase 3. And that's what we are talking about. We used to talk about 12 to 18 months. Now we are talking about months to be able to get the vaccines if it's all working. But remember, there are 20 different companies and 20 different, there are different people doing these vaccines, and it's long to go. We need to wait and watch.
Yes. So irrespective of the pace at which people are trying to develop the vaccine, it's still a long road ahead. Our next caller, Mukhtar, is dialing in from Lucknow. Go ahead.
Hello?
Yes, sir. Go ahead. Ask your question.
I just wanted to know, good evening, Rishika. I just wanted to know diabetes of... Hello?
Yes, sir. Go ahead. Ask your question.
Dr. Balaji, I just wanted to know whether diabetes patients can be asymptomatic.
All right, Dr. Balaji?
Yeah, I think, it depends. For example, if you have recently contracted the infection, and if the viral load is significantly on the lower side, then definitely you could be asymptomatic for a period of time. This could be the incubation period, and then probably after a while you could develop symptoms, but that is very unlikely because diabetic patients any which ways have lower immunity. But yes, they can be asymptomatic for a short period, but very unlikely for them to be asymptomatic throughout, not having any symptoms at all.
All right, our next caller, PK Mishra, is dialing in from Bhubaneswar. Go ahead.
Good evening, Rishika. Can you hear me?
Good evening. Please ask your question.
Yeah, the question is regarding to related to immunity actually. So it is said that people who are immunocompromised are having symptoms, and most of the people are actually overcoming the disease because of the immunity power. So my question is there any test that can ascertain our immunity power?
Right. Dr. Refai, would you like to take that on?
Sure. I mean, there's no specific test as such to identify your immunity levels. And particularly, remember, the immunity levels of virus are different from bacteria. So it is not like any specific test. In general, people who have long diseases, like chronic diseases like diabetes, heart problems, hypertension, they tend to be, because of the mechanisms it works, they tend to have slightly lower immunity compared to people who are doesn't have any of these comorbid conditions. So what we know from the data is the infective rate in both diabetes and in non-diabetics or in heart patients or without heart patients is equivalent in terms of getting the virus. If the interpretation or the effect of the virus on you depends on what your immunity is. So it doesn't mean that if you're not diabetic, you don't get the virus, or if you're a diabetic, you will get the virus. You will all get the virus. But the thing is, how they react to the body, how the virus reacts in patients of diabetes and heart patients compared to those who doesn't have a heart doesn't have a heart problem or diabetes different.
All right, doctors, appreciate you joining us on the broadcast. You've been very kind to take on all those questions so very patiently. Thank you once again for sparing the time of day. That's all we have time for on the broadcast. India has crossed 50,000 cases of the coronavirus as we end this broadcast. But coming up next, Sonia Singh on the 8 p.m. news will bring you all the details. Stay tuned.